it comes to putting a loved one into assisted living or nursing home, normally the staff are more than willing to help. But if they happen to be in the hospital, then the first 5 items on this checklist will be done by the hospital. Otherwise, you are more than welcome to take time out and make an appointment with the patient's primary care physician to talk about this checklist in order to help you begin to prepare for the big move into a nursing home. 1. You will need to have the physician's admission order to a skilled nursing facility. The doctor will need to confirm that your loved one needs to be in a nursing home. This is almost like a prescription. 2. You will also need to have a physician's order for treatment and medication. Your loved one will receive a new physician and caregivers at a nursing home. In order for them to care for your loved one, they will need to have an order from the prior physician or hospital staff. 3. You are also going to need to have your loved one's history and physical. The attendant at the nursing home will need to have up-to-date information on your loved one. The physician should also perform a physical and update the person's medical history. 4. You will also need to have a state-required form. Each state has its own required form that may have different names that just states that your loved one meets the state nursing home criteria. This means that their medical needs can be performed at a skilled nursing facility. You can get this from the physician or hospital. You can also get this at the nursing home where they will be going. Financial assistance is only granted if your loved one meets the state criteria, and this form is required before the state decides if you will receive financial assistance. 5. Your loved one will also need to have a negative TB or tuberculosis test or chest X-ray according to the nursing home policy. Tuberculosis is an airborne, communicable disease, and all nursing homes are required to make sure that their residents do not have or carry this disease. 6. Next, you will need to have all the completed admission paperwork before your loved one goes to the nursing home community. Normally, the paperwork can be filled out the day your loved one is admitted, or before they are admitted. Many nursing homes will have different rules, and most often the admission paperwork will be filled out at the facility, and with a staff member. Your loved one will have to sign their name several times after they have learned all the important information. Due to state and federal laws, the nursing home will need written proof that your loved one has learned the information. Part of the paperwork is a consent to be treated, so you may need to bring your loved one's social security card. 7. You have completed the financial obligations to the nursing home at the time of admission. This ensures that each patient will have the means to pay for their care. You or your loved one must disclose any financial information, as well as providing any proof which includes, but isn't limited to, answering the following questions. Is the patient enrolled in Medicare, Part A or B, or Medicaid, or do they plan to apply? Do they have any supplemental insurance? Does the patient receive any type of railroad retirement, SSI funds, private or government pension, or veterans benefits? What assets do the patient have, including checking, savings accounts, cash, CDs, trusts, real estate holding, stocks, or bonds? Does the patient have paid-up life insurance, burial insurance, or long-term care insurance? Has a patient transferred any assets within the last 3 to 5 years? What is the current living situation for the patient? Rental housing? Own their home? What is the monthly amount for mortgage or rental payment? The nursing home does have an obligation to determine if any incoming requests meet the criteria for any federal or state funding. This process is similar to a person trying to get a loan or a mortgage. The nursing home is basically your loved one's new home.